Jamie Mills, welcome back to the Holly Field Nutrition Podcast. How you doing?
I'm good. Thanks for having me back. I'm excited.
Yeah, we just caught up a little bit offline talking about our different phases of sleep regressions with our son. So
So we're both a little
appreciate
sleepy today.
both a little sleepy, trying to get our snacks in. But I appreciate you being here to kind of come back and talk about kind of like the medication side of weight loss and weight management. I know last time we spent a whole episode talking about bariatric surgery specifically, and like I kind of wanted it to be all one topic and realized quickly there's no way. Like these can
Yeah,
both like be dedicated to their own episodes or even their own podcasts entirely. So I'm super excited to have you back on the show today. Do you want to just refresh everyone on your professional and personal experience with GLP-1 medications and using these in practice with your clients? And then also, I know you have personal experience too.
totally. For anyone who doesn't know, hi, I'm Jamie. I am a registered dietitian and I specialize in bariatrics. And I like to explain to people, because a lot of people don't know this, but bariatrics is the field of medicine that treats obesity. Obesity is a disease state, and a lot of people like to argue that, but it is concrete, it is a disease. And the field of bariatrics treats obesity with two main avenues. There's the surgical route, which, weight loss surgery. I have had weight loss surgery, so that is primarily what I focus on in my practice and in the space I work in. But alongside that is the medication management of things. And that is part of bariatrics. So there's those two methods of really treating obesity. So I had weight loss surgery, and I've also been on GLP-1s now twice in my life. And the reason GLP-1s are making such like headway and into the mainstream media is it truly is the first time with medication management that we've seen promising significant results. So we've had weight loss medications, which are called AOMs or anti-obesity medications, for decades. And they've gotten a bad rep over the years because there's been some like sucky ones. I talk about this in my book. I have two chapters on it, and one is like part of like the history of these medications, because there have been terrible medications over the years. There, diet pills, things that are just, not good for your heart or whatever. So you've probably heard of things like phentermine and Qsymia or topiramate, and some of these do have some positive effects on weight loss, but the GLP-1s have a very significant effect on weight loss, averaging anywhere from like 15 to 22% of body weight, which is comparable and close to surgical weight loss results. So with all that being said, obesity is a disease, and it's a chronic disease for people who've struggled their whole life. So I had my weight loss surgery in 2017, and I did really well. I was on paper that success story after weight loss surgery. I lost 112 pounds. I was feeling really good. And I did, over the years, after maintaining for a few, I'm now 7 years post-op, so I've had quite the journey so far. Around year 3 post-op, I started to have a little bit of regain. It wasn't significant, and some might even say it, wasn't necessary to go on a GLP-1, but I was more afraid of the trajectory upwards I was seeing than anything else. And I wanted to do something about it before it got out of hand. Along with that, I do have PCOS, which is polycystic ovarian syndrome. And I did notice with the change in my birth control was when that regain started to happen after maintaining for so long. And it was really scary because I was, going to CrossFit 5 days a week. I was still in my routine. I was following my meal plate method. I was practicing what I preached. And when I went to the ASMBS meeting, which is the American Society for Metabolic and Bariatric Surgery, it was a conference in June of 2022. I was sitting there in a panel about regain. And one of the dietitians speaking and presenting had said, "What do you do when your patients regain? Not if, when, because statistically everyone is going to regain at least some of the weight." And that was very validating because I had a lot of shame around the fact that I'm a dietitian in this space. I had surgery, I help other people, and I'm still struggling.
Yeah.
But that conference was very validating, just talking about, it's a disease and you can do everything within your power, and sometimes your body fights you. So at that time, during that presentation, they talked all about the anti-obesity medication, specifically semaglutide, which is one of the GLP-1s. We can get into the different types after. But it was after that, I was like, you know what? I want to be on this. This is promising. I want to be proactive. So I had about 25 pounds of regain after the 112 I lost, which still I was in a really good place. But I ended up going on Mounjaro in the summer of 2022, which is tirzepatide, another type of GLP-1. And I ended up being on it for a little over a year. I was on it from August to the following September, and I had lost about 50 pounds. So not only did I lose the 25 or so I regained, I lost more. I never felt better in my entire life, and that's including those early post-op years. It helped my brain more than anything else in magical ways I had never experienced before. Um, I honestly was the healthiest I had ever been. And then I ended up titrating down on the medications because I knew that we were going to start planning to start a family, and you can't be on them while you're pregnant or breastfeeding. So I got off, and then I did conceive rather quickly right after. One of the things to know about these medications is they do, you'll probably hear something called Ozempic babies.
Yeah.
Being on these medications do lessen the effects of birth control, and because it helps with insulin resistance and other hormonal factors, people are finding they're getting pregnant more easily with them, which is positive or maybe not so positive depending on
Yeah.
your
Yeah. Depends
um,
on the goal.
depends on the goal. For
Yeah,
me, that was a positive.
for
During
sure.
my pregnancy, I gained a considerable amount of weight. Really had a hard pregnancy. I don't have to get into that because we can, but anyways, I ended up gaining quite a bit of weight back after during my pregnancy. So now that I am postpartum, I am not breastfeeding. I am back on a GLP-1. This time I'm on Zepbound, which is still a tirzepatide medication to support me in my postpartum weight loss. So all that to say, I've had surgery, I've experienced maintenance, I've experienced regain, I've experienced these medications, I've experienced pregnancy and postpartum. So I've had many different scenarios, I guess, when it comes to this bariatric journey. And with all that to say, I specialize in the field and this is what I help people with. So I do see things, personally and professionally.
Yeah, I think it's important to note that, like with weight loss surgery, we talked about this a little bit in the last episode too, but weight loss surgery, medications, like there's no finish line. Like this is your life, right? Like you have many, many years hopefully left to live. And we kind of have to like just navigate different scenarios. Like you said, I mean, the hormone situation when you're on birth control versus not, versus pregnant versus postpartum is so wildly different in each of those scenarios, especially if, like you said, you have PCOS too, like, and that's kind of an added layer on top of it that, yeah, things are going to like respond differently, I would imagine, in all of those different
Totally. Well,
scenarios.
even like the medication seems to be responding differently this time than last time. My body is just so different. Also, when I had my weight loss surgery, I was 24. I
Yeah.
am now almost 32 this year. Like my body has changed even, without all these other factors,
Yep.
so it it's always a little bit different depending on the season you're in.
Yeah, I think it's so interesting, like when we talk, and I know we'll talk a little bit about like how the medications work and whatnot, but like the research too, like with weight loss medications, weight loss surgery, that's why I think some of like the argument against like, what's the long-term research like? It's like, well, people aren't lab rats, like they have lives and things change over time. So it's really hard to compare like one person's journey with a medication to another person's because we're all so different too.
Totally. And I think, there's so much negativity and stigma around the medications, just like with surgery, maybe
Mhm.
even more so because it's been getting so much hype in the media. But um, a lot of people like there's kind of two arguments there. A lot of people are like, well, we don't know the long-term effects and the long-term like results. Yes, we do. We've had GLP-1 since the 80s. Like we have 20 plus years of GLP-1 research under our belt. So we do know for the most part, maybe not every long-term scenario, and tirzepatide is newer compared to semaglutide, but we have a lot of research on GLP-1 medications as a whole. The other piece of that, in terms of like looking at the long term, a lot of people are saying, well, you're not going to keep the weight off long term. That's not necessarily true. But the thing to remember is medications are designed to work while you're on them. So if someone has high blood pressure and they go on a high blood pressure medication and their blood pressure comes down, we don't just yank them off the blood pressure medication because it's going to go up, and that would be expected because you're not reaping the benefits of what you're taking. It's very similar with these medications. So while you can sustain some, if not most, of the weight loss, you might not sustain it all if you come off of them. But people say that like it's this like trick. Like, well, you're going to go on these medications and you're going to lose all this weight and then you're going to come off and you're going to gain it all back. It's like, well, we know that for the medication to work, we have to be honest. That is something to consider long term. So just speaking about, the time lapse of these and, the history versus the future, I think both of those things are important to note.
Yeah, it's all in constant motion. Like, and people on medications too, like you have to tweak the dose sometimes, you have to switch like there's not, it's, I think there's a bigger conversation around like what's in it for the pharmaceutical companies and what's in it, for, big pharma or the medical system. But I mean, that's just real, like a lot of the people who are doing research on these medications or who are prescribing them, like have great intentions, have the patient's best interest at heart. Like, we don't just want you to be on a medication for life because it makes people money. Like, it's
Mhm.
usually not that simple. There's,
Be a chronic disease, and I think we talked about this last time too, like, even
yeah,
once you've lost weight and maybe are of, like, a normal BMI or no longer considered
right.
clinically obese, if you've had obesity in your life, especially since childhood and, like, many years of obesity, even when you're in, quote, "remission" or no longer like, obese by, clinical definition, you're still going to be working to maintain those results. And as I shared, and that's just my experience, but most people will gain at least some of the weight back because it's very difficult to keep it off long term because of, just the fact this is such a multi-layered, multifaceted disease state. So if we have medications that can at least support us, just like with any disease, why wouldn't we utilize them if we can? Obesity is one of the only diseases, probably alongside like addiction, that is so stigmatized because of the weight bias. It's like people just don't view it as a disease in the same way. We wouldn't be you know, telling people, if this was a medication that could help with heart disease, which spoiler alert, it can help with heart disease,
Mhm.
diabetes, and a slew of other amazing things. Um, we wouldn't tell people, well, you probably shouldn't be on it because what if you have to be on it long term? If it could cure or significantly improve someone's heart disease, most people wouldn't bat an eye at you going on the medication. But because it's obesity and you have to be deserving of your results and you have to work hard enough and not take the quote easy way out, it's a different conversation and it's very frustrating.
1000%. And like you said, I think it just being blown up a lot in the media recently has, like, there's more people entering the chat on this that may not have the clinical experience working with people or just don't know what they're
Part
talking about.
And part of yeah, so the results for the weight loss are phenomenal. That's part of why mainstream media has really paid attention to this. But alongside that, just like with anything else, there are people who are going to misuse and abuse these things.
For sure.
So unfortunately, especially in, Hollywood, for example, that's where there's been like a big light, like kind of shined on this, is people are using it for what's called vanity weight loss. These are not vanity medications. So they are not meant for you to just lose, 10 extra quote stubborn pounds so that you could be of an abnormally low weight. So what's happening is we're seeing people of, and when I say normal weight or like clinically defined as obesity, I am referring to per the BMI chart because we use that as like a clinical standard, not because it's necessarily the end all be all. And we know that BMI is majorly flawed, but just, when I say normal weight, I'm talking about per the BMI scale, like in a normal quote weight range, like a healthy weight range, which again, nuances there. But when you have
Yeah.
someone who is of a quote normal body weight, getting access to these medications because you have the financial means to do so because you are famous and in Hollywood or have access to, you know, some sketchy doctor out there who's going to just prescribe them to you for your money. It
Mhm.
happens. And then you lose an excessive amount of weight so that you could be, underweight or again, that vanity weight loss. That is where they're getting a really bad reputation. And it's really taking away from the amazing benefits these drugs have for those who need it because of these disease states.
Yeah, thanks for jumping into that. I think that's important to touch on, to kind of like go over the background of, like you said, these have been around for a long time, like they're not new really. Like, what are the most common like brand names slash, medication names of the most common ones? I know we hear about Ozempic, but that's not the only one. And how do they work in the body? Because part of what you said with your own personal experience too is like it really kind of helped your brain. So I'm super interested in just like what you mean by that in relation to how it works.
Right, so let me just like geek out for a minute and talk about all the things.
Yes.
So the main GLP-1s you're going to hear of are liraglutide, semaglutide, and tirzepatide. Liraglutide is a little bit of like an older GLP-1 medication, and that's going to be under the brand name like Saxenda. You've probably heard of that one. That one's not used as often because, to my understanding, it doesn't have the quite as many benefits as semaglutide and tirzepatide. So semaglutide is a GLP-1 medication, and GLP-1, just so everyone knows, is an incretin hormone that is produced in your gut. So we naturally do produce GLP-1. GLP-1 increases satiety, decreases hunger, and can significantly help with weight loss. So semaglutide is a GLP-1 that targets the same things that GLP-1 does in your body. The reason, and I'm just going to note on this here while we're on the topic, the reason these GLP-1 medications work. So most of the time they're injectable medications that you typically take once per week. They are meant to be titrated up or down depending on what dosage you need to see the benefits. So when you are getting these GLP-1 injections, yes, your body does make it naturally, but the reason these medications work is because when you are giving yourself that injection, you are getting the GLP-1 at a therapeutic level at a continuous rate in your body. So when you have semaglutide in your body or a GLP-1, you're increasing your body's GLP-1 by up to 700%. So you are significantly increasing it. This is why people are seeing such benefits from it. So semaglutide is one of those GLP-1s, and the brand names for that are Ozempic and Wegovy. Ozempic is the FDA approved form of semaglutide for type 2 diabetes. And then Wegovy is the FDA approved form of semaglutide for obesity.
Okay.
We have the exact same active ingredient. It is both semaglutide. It's essentially the exact same medication. They just have different FDA approvings based on the medication. And it's, I always mess up how to say the name. It's like how do you say the brand name?
I have no idea.
Let me,
I also, I know, yeah,
sorry.
you go, no, go for it because it's going to bother me too.
I just can't like pronounce it properly. Nordisk.
Yeah.
Novo Nordisk.
Novo
It's
Nordisk. Yeah.
Novo Nordisk. I always botch the name, but that's the like brand name, like
The company, yeah,
the company, the manufacturer
like
that
the pharmaceutical
manufactures
company.
yes, thank you.
Yeah.
Sorry. The pharmaceutical
No, you're good.
that manufactures Ozempic and Wegovy, which are both semaglutide. And again, same ingredient, same exact thing, same dosaging, just one is for technically for type 2 diabetes, while one is for obesity, which is why it's really frustrating when people say you're taking medications from people who actually need it with type 2 diabetes, or that's only for people with type 2 diabetes. That's not true. We were before the FDA approved it for obesity treatment. Physicians were prescribing it off label for obesity because we knew it worked. And we had these clinical trials, which was still totally A-okay to do. Doctors do that all the time for many medications.
Oh, yeah.
Moving over, we also have what I said was tirzepatide. So tirzepatide is a dual acting GLP-1 essentially. So it has GLP-1 and GIP. So GIP is another incretin hormone that does similar things as GLP-1. So you're kind of getting it like I guess more of a benefit typically. So a lot of people will see anywhere from 15 to 18% weight loss with semaglutide medications, whereas the long-term trials with tirzepatide are seeing upwards of 22.5% weight loss. So it is a bit superior in terms of weight loss. The other really fascinating thing about tirzepatide is they found it has antiemetic effects, which means you have less symptoms. So one of the things that can be troublesome sometimes with these medications is the side effects. So when you take semaglutide, not everyone, everyone's different, but a lot of people experience GI symptoms such as potential nausea, upset stomach, bloating, could be constipation, diarrhea. Now you absolutely can and may have those side effects on tirzepatide. It's just less likely and less people experience them, or at least not at such a high rate. Some people will go, and everyone is different. Some people will go on semaglutide or and say, oh my God, I had such severe nausea, like I can't be on it. And that does happen. The other thing to note is with the side effects, the longer you're on it, the more your body adjusts. So if you can kind of get through that first hump, most people do find that they feel pretty good on them afterwards. But with tirzepatide, like I said, it's a dual acting one. It's a little bit stronger and less side effects. So a lot of people prefer that one. But everyone's different. And some people see better results on semaglutide. Some see better results on tirzepatide. And Eli Lilly is the manufacturer for tirzepatide. They're like the pharmaceutical company. And we have two medications for them as well. We have Mounjaro, which is tirzepatide, that is approved for type 2 diabetes. And then we have Zepbound, which is tirzepatide that is approved for obesity. Zepbound is the newest. It came out within the last year. So, like I said before, I was first on Mounjaro. When I got on it in 2022, it was prescribed to me off label for obesity. And now that they have Zepbound, I am now on that one because it's the one for obesity. But again, it's the exact same medication, same deal. And one of the other ways these medications work is it slows down gastric emptying. So you do feel fuller longer. So that's part of what these incretin hormones are doing. So I know it's probably pretty heavy on the science and the terminology, but that just
What we wanted.
yeah, it gives you like an overall picture of, the types of medications that we have. And then of course there are compound medications, which um, can be a more, I guess, polarizing conversation. And, compounds, so everyone knows, compounds are not FDA approved. Someone explained it to me as they're not really FDA approved, more so they're FDA allowed. So compound medications are legal. Compounding pharmacies basically mix the medications right then and there in their pharmacy. And this isn't the proper term, but the best analogy I can give, it's almost like a homemade version. And compound pharmacies, you want to make sure that if you're going through a compound pharmacy, that you have one that is state regulated and reputable, essentially, because there are some like sketchy ones, and then there are, very reputable ones. So a lot of these telehealth companies that, are offering just semaglutide or tirzepatide are doing so from compounds. The reason people choose compounds is because they are cheaper and more accessible, because with the name brand, not one of the biggest barriers is affordability, insurance coverage, prior authorizations, and shortages. So on that note, the reason that compounds are allowed, to my understanding anyways, the reason the compounds are allowed to be made at these, pharmacies is because there are national shortages specifically of tirzepatide. So with the national shortages, they are able to make them at these compounding pharmacies. Now that all is up in the air, and by the time this, episode comes out, it might even be different. But Eli Lilly came out with a statement recently saying that there's no longer a national shortage. So they are basically making it so that these compound pharmacies have to take their tirzepatide off of their list of medications. So people are panicking and freaking out about not being able to get their tirzepatide. To my understanding, there's some type of hearing that's going to be happening in November, and until then, they've paused the halt on them. But we still don't know if we're going to be able to get compounded tirzepatide. So some physicians are in support of them, some are not. You still need a prescription for them. But people have various views on compounds.
Gotcha. Thanks for diving into that too. We love the science. We love the nerdiness.
I'm just making
Never,
I could
never
talk about
apologize.
hours.
No, it's super helpful. And I think it's helpful for people to understand that there are pretty much like the same medications. They are just prescribed for different reasons under different names, and it's not off label. And if it is, that's something that is, again, similar for other medications for other ailments and diseases, that just has less stigma.
For whatever reason, people get real mad when people are getting prescribed these medications that are meant for type 2 diabetes. There's this idea that somehow, especially with the shortages, that like we people with obesity on them are taking them from people who actually need them. You get into a real big ethical dilemma when you're talking about,
Which disease is like worse. Yeah.
yeah, which
Yeah.
again, then you have people that say, well, obesity is not a disease. The thing is, it's a chronic disease that leads to these other ones. So we really do want to be preventatively treating these other diseases by treating obesity. The other thing with that is, oh gosh, what was I going to say? I had another explanation there. It's going to come to me. Oh, what I was going to say is doctors prescribe medications off label. So a really good example of this is metformin is a medication that is prescribed often for type 2 diabetes all the time. It has been for years. Also for years, it has been prescribed for obesity and PCOS. So as a PCOS patient, I've been on metformin twice in my life. Didn't tolerate it well. I got way worse side effects on metformin than I ever did on a GLP-1, because other people are like, well, the side effects are so bad on GLP-1s. There's side effects with every medication, and metformin, in my opinion, for me, was horrific. Never even close to anything like that on, I felt great on my GLP-1s. But my point is, I was prescribed PCOS patients and people with obesity are prescribed metformin all the time for insulin resistance.
Mhm.
Not once ever did I ever hear someone say, and I've worked with PCOS patients, I've worked in this field for a long time now, and I've had PCOS since I was 14. Not once did someone ever say, you shouldn't be on metformin because you're taking it from someone with diabetes. You don't
For sure.
actually need it. It's just for people with diabetes. And guess what? Metformin hardly works for weight loss. It's anywhere from 3 to 5% weight loss in some people, not even all. It's very, very minimal, especially when you're talking about someone who's morbidly obese taking them. 3% is pretty negligible. But now that we have a medication that works beautifully, that can make someone not obese anymore, people are very mad about it. And again, I think a lot of that goes back to the stigma and the weight bias. So it's just interesting because prescribing meds off label is a common practice used across the board for many different disease states for many different medications. But for whatever reason, people are very mad about it in this scenario.
And I think when things are prescribed off label too, whether it's metformin, any medication, I feel like there's always going to be, yeah, like a bad egg where it's done and it's maybe not like the person didn't get support or it didn't work out well. But like you said, primarily of the time, like everyone has their best interest at heart. You're not taking the medication from someone else. And yeah, I think we are
And I
talking
think
about stigmatizing of that particular disease for sure.
I really wish, especially with the backlash, I really wish it would fall back on the pharmaceutical companies versus the patients because,
Yes.
and again, people with obesity, a lot of people are pre-diabetic, have diabetes. As someone with PCOS, I am at a much higher risk for diabetes. We're finding that these medications are helping with heart disease. They're helping with addiction and addictive personality types. They are helping with so many things. Like
Mhm.
they are bringing wonderful benefits to many people who truly need them.
Yeah.
And it's unfortunate that instead of viewing it as, oh, more people are in need of this, how do we get this for all who need it and make it affordable and accessible? Instead of that, it's you're taking it from other people. When really, we should be looking at the manufacturers saying, in my opinion, anyways, why is it so expensive? Why is it so hard to access? Why do we have all these shortages? Why can't we keep up with the supply and demand? It's a supply and demand issue, not a who's more deserving issue, in my opinion.
For sure. And like you said, a lot of the times taking it from someone else who needs it with type 2 diabetes, sometimes we're talking about the same person. Like that person has both things and needs it for both reasons. There's a lot of overlap.
People will say things, well, your obesity, you have obesity from your own choices. Like you made poor choices and you should be eating healthy. And if you just ate more and if you just weren't lazy and you ate less and moved more, you wouldn't be here. And again, those are all just, really generalized statements and stigmas attached to it. But if we are going to play devil's advocate, many disease states can be managed with lifestyle changes. So, obviously people are prone to different things. And I'm not saying by any means, in any way, shape, or form, that is of anyone's own personal fault that they have a disease. But if we are really looking at things, we can prevent type 2 diabetes in many situations with lifestyle changes.
Yep.
We can prevent heart disease in a lot of situations, not every, but in a lot with lifestyle changes. But we're not yelling at those people.
Mhm.
It's interesting to me. The
Yeah.
other thing to note is a lot of people are like, people with diabetes are gonna die without these medications. That's also not a true statement. Type 2 diabetes and type 1 diabetes are very different. And if you do not have insulin and you are an insulin dependent person with diabetes, yes, that is a different scenario than talking about managing chronic disease states when there are multiple other medications also on the market to supplement with. So these are just things that I'm throwing in here as like tidbits to the conversation as a whole, because there's lots of arguments. And unfortunately, a lot of people don't know how to speak back to those arguments sometimes.
No, it's so true. I think a lot of the arguments are being made by people who just don't quite understand or aren't like working with actual humans taking these medications.
And just
Um,
so no one mistakes anything I'm saying here,
Mhm.
type 2 diabetes is a very, dangerous, life-threatening chronic disease that absolutely needs and is deserving of treatment. By no means in any way, shape, or form am I saying people with type 2 diabetes shouldn't be getting these medications either. I'm
Right.
just saying that we need to figure out how to get better care for all, and telling people, especially people with obesity who are on Wegovy and Zepbound specifically, those medications you can't even get covered by insurance for people with type 2 diabetes because they are not for type 2 diabetes, those are for obesity. So, and again, it's the same medication. So it drives me absolutely out of my mind, especially when I see like other dietitians or other health professionals saying, you shouldn't be on Ozempic. It's not even for, like, it's just for people with type 2 diabetes. Like, that's technically true per the FDA, like, approval, but it's the exact same thing as Wegovy. So like, it's kind
Yeah.
of, again, it's misleading.
Yeah, it's super misleading. And I'm not sure how comfortable you are speaking to this too, but like from your experience, also just from working with other people taking these medications, what is like the accessibility like? Like how expensive are they? Are they covered by insurance if you have certain diagnoses? Like what does that look like?
Super expensive. So
Yeah.
paying out of pocket for these medications is usually like $1,200 to $1,300 a month out of pocket with
Oh,
no insurance coverage. They are super freaking expensive.
yeah.
Most people, myself included, cannot afford that.
Yeah.
Um, at least not on an ongoing basis, especially because we know these need to be taken long term. So that's
Right.
long term investment is a huge consideration. Um, some people's insurance covers them, which is beautiful if they do. I'm not so fortunate. The manufacturers over the years have come out with various savings coupons. So if you have commercial insurance, like I have Cigna, for example. If you have basically, as long as it's not like a state-based insurance, if you have a commercial insurance that denies you these medications, you might be able to get a savings card. So when I first got on Manjaro, they had the most beautiful savings card I've ever seen. So this was before it became super mainstream and they got like real popular and many people wanted it off label for obesity. But they had a savings card back in 2022 where my insurance didn't cover it for weight loss, but I was able to get the savings card to make it $25 a month. So my year on Manjaro, I got it for $25 a month. They put a halt to that. They changed it, and my heart bleeds for people who were not able to take advantage. But I was one of the lucky ones who was able to. And
That's so wild.
what I did towards, because I was on it a little over a year, what I did towards the end was I also was, because I was purposely titrating down to get back on the lowest dose and come off of it. I was also spacing it out every 10 to 14 days versus every 7 days with the guidance of my doctor. Like I was spacing it out longer. So they were lasting me longer. So I didn't have to be investing in it like additionally. Fast forward, now we are in 2024. I had to like really think about that for a second. What year is it? Um, I'm on Zepbound and I am on their savings coupon again. The savings coupon is kind of sucky now though. The savings coupon for Zepbound right now, and it expires in December for me. So I don't really know what I'm doing after that, to be completely honest.
Okay.
Right now it's $550 per month, which is still very expensive. It's much better than $1,200 per month, but
Sure.
it's, $550 per month. And, I'm in a situation where fortunately my husband has a healthcare savings account and I'm able to do that. But even for myself, that's a short-term answer because one
Yeah.
lifelong that that's a car payment. Like there's no
Yeah.
like
With
to
the
invest.
mortgage, like that's so
Yeah,
like
it's
the
so expensive.
difference is so wild.
It's
Like how
wild.
it can be $25 or $1,200.
And again,
Like,
it depends on and if your insurance covers it. Like I know someone who's able to get it through insurance for $90, whereas someone else is able to get it for the 25. It's just so this is just one example. You have to go on the websites to see what the manufacturer coupons say, but this is one of the reasons so many people are moving towards compounded ones because you can get compounded medications for anywhere from like 150 to 300 per month, depending on the type, most places. So yes, still expensive, but if you're going to get on semaglutide so I know the Wegovy savings coupon makes it like 600 per month. So, you can get compounded semaglutide for $150 per month some places, or you can get Wegovy for 600 per month. Which one are most people going to choose? And this is where it's a real battle with compounds because it's like, well, you don't know exactly what you're getting. The viscosity of them might not be the same. To our understanding, the majority are safe, but are they as effective? Like there's a lot of considerations when it comes to compounds and they're not FDA approved. So it's really frustrating. Like I said, I don't even know for myself what I'm doing after December. Just gonna wait and see.
yeah, that is so frustrating. Thank you for sharing that because I think that's an important component too. Like most people aren't just like, I think I'll just go get this medication, and happily spend 1,200 a month. A lot of people with like realistic incomes probably are having to have a lot more thought put into that process with their doctors and everything
Correct.
versus just getting it for free somewhere.
And one of the questions I've been asked a lot is, should I do that? And I'm not the one to say I'm not your doctor, but like, should you do this instead of having weight loss surgery? It's less invasive. It's not permanent. And I've been asked a lot over the years, had this been on the market when you had surgery, would you have done it instead of surgery? And my answer to you is yes. If I had back in 2017 when I had my surgery, if GLP-1s were an option instead of surgery, I absolutely would have gone with the GLP-1 route because I was so scared and anxious about surgery.
Mhm.
However, I am so glad that that was not the case or the option because I needed my surgery. In my opinion, especially for those with severe chronic obesity, if you qualify for weight loss surgery, that is still the gold standard for weight loss and keeping the majority off. And you're, even though that has its own accessibility issues, when you look at the cost, especially if your insurance does cover it, it's probably more cost effective still.
Mhm.
And like I said, for me personally, I needed both tools. The,
Yeah.
surgery targets your anatomy and, some of these hormone regulations. But then also the mindset piece and the head piece with these medications is really drastic too. So
Yeah.
for myself, my best combination has been both of them. But I still am so glad that not choosing surgery wasn't an option for, like, surgery was the only option for me at the time. And I'm very glad that it was because I don't know what my life would look like if I didn't have it.
Gotcha. Yeah. Thank you for sharing that. I think that's an interesting conversation, and they're tools. So like,
Of course.
yeah, they're going to work, like people are going to respond differently to each one. And I think, yeah, my understanding too is that weight loss surgery is still like the gold standard
It is.
for, yeah, for that, for treating that. Yeah. So I think, we talked a little bit about side effects. I know you said, GI issues. I think too, like, side effect, but also like kind of the point of the medication too is, appetite reduction is what, we kind of see talked about. And I think it's a slippery slope, right? Especially coming at it from a nutrition perspective. It has its pros. I know how I'm seeing it in practice, where people who have a history of an eating disorder using it, or people who have, they're trying to train for really big athletic events and they're kind of struggling to meet their energy needs anyway. It can be a slippery slope for some people. How do you help people navigate this from like a nutrition support perspective? And is that something that is like you get a prescription for these medications and you automatically get this nutrition support?
So I wish you automatically got the nutrition support. You don't, and kind of have to seek it out yourself in most cases.
Yeah.
Um, I can't stress this piece enough. The goal is not to have no hunger at all. If you find that you have zero hunger and are going all day without eating, it's a sign that maybe you need to come down on your dose, definitely work with a dietitian. It's not the goal. You
Yeah.
absolutely still need to eat, and you might have to eat more proactively, meaning you might not have such strong hunger signals, but you still need to be eating throughout the day. So eating small, frequent meals, getting your protein in. One of the potential quote issues with these medications is risk for muscle loss. So, and some of that has been really demonized in the media too. Whenever you
Yeah.
have extreme weight loss, whether that's surgery, without a tool, with medication,
Mhm.
you're not just losing fat mass, you're losing muscle as well. And we want to have more muscle on our body because muscle is more metabolically active than fat, meaning you burn more calories at rest. You're going to sustain your weight loss long term. Also, for strength, especially in your situation with runners avoiding injury, we
Mhm.
want to maintain as much of that muscle mass as possible. If you're not eating enough and you're not getting your protein in, that's not going to happen. So I'm super, a little bit of bragging rights here. I'm super proud of myself for when I was on Manjaro in 2022 into
Yeah.
2023 because I was very diligent with my training regimen, going to CrossFit and my protein and forcing myself to drink the protein shakes even when I didn't want to. And not only did I lose the weight I wanted to, my muscle mass actually increased. I was able to build muscle. So it is not impossible. It just takes a lot of diligent work. And to make sure you're not just losing weight, but being the healthiest version of yourself, it's so important, especially important if you know that your time is limited on these medications and may have to come off. You're going to be able to maintain that weight loss better. One, if you have the really great habits of already, because eating healthy and working out and those things don't go away. That's these medications, just like with surgery, is not a replacement for healthy lifestyle changes. So, one, you want to do it for that reason, but if you can maintain more muscle mass along the way, you're probably going to sustain that weight loss better. Um, did I answer your question? I feel like I just went off on a tangent.
No, absolutely. That was great. And I love the bragging rights because I think that's important because it is possible to
100%.
not lose muscle mass. I think that's often demonized. And it's something that I think should be like cautioned because we don't want people just losing a bunch of muscle mass and not doing anything about it. But it's possible to not have that happen. And I think the whole like underlying, hey, we still need to, strength train, we still need to exercise, we still want to be eating enough protein. I think all of that to us is like kind of obvious and important, but maybe to the average person just getting the
Well, I
support
think
just isn't there.
too many people, I think, have just been traumatized by like diets and diet culture over the years where exercise or eating a high protein, like balanced diet might be more of a punishment. So it's really
Yeah.
easy to think like, well, I'm losing weight anyway, so why do I need to work out if I'm already losing weight? Because some people will only,
Mhm.
work out because they have to lose weight, and it's not coming from like a place of desire or want. I think it's really important to still work really diligently on those mindset shifts. And we might have talked about this last time, but like, what exercise would you do every day just because you enjoyed it? Like finding
Mhm.
that joy from it in your life and making it that lifestyle change is still so important. Um, so because it's really easy to see the scale moving and saying, oh, well, the scale is moving and I'm losing weight pretty rapidly, or I'm losing weight like so, much more readily now. I don't need to go to the gym. I can just eat the small portions of, the more unhealthy options because I'm able to. And again, it's very parallel with, some of the struggles we've had with surgical weight loss surgery patients is you still need to make the habit changes to sustain it long term and to be the healthiest version of you, not just the smallest.
Healthiest, not smallest. I love that because like you said, yes, the weight loss can be a huge like part of the equation, but it's not the only part of the equation. And the longevity you're going to be able to have with those habits is super important. The scenarios I've started to see a lot in the endurance community space for athletes is people taking the medication, like you said, just not eating all day, no appetite, not really getting much support or follow up with that, and then they're losing their periods, they're losing their hair, they're getting nutrient deficiencies, they lost muscle mass, they're injured, they can't even fathom the idea of exercising because they're so exhausted. They come off the medication and then they're in my office, my virtual office, trying to dig themselves out of a hole. And that's where it's like it's not super black and white. Like, should that person, have been prescribed the medication? I don't know. Like maybe there are benefits to it, but only if they're doing those other supportive things and having like support and like communication with their providers along the way. And that's a two-way street too.
It needs to really
But
be like an interdisciplinary team approach, which we
yeah,
do in so many areas anyways. And one of the things that I think is important to say too, and I might get pushback or, some disagreement on, having being having history or having history of disordered eating isn't not necessarily a contraindication for being able to be prescribed these medications. That being said, though, if you are in an active eating disorder, it would probably be a contraindication, and even if you have a history of it, it's really important that you are forthcoming with that information when going on when or talking to a provider, so that your provider can help you, make sure that you're seeing a therapist, make sure that you're working with a dietitian to ensure you're not falling into, old patterns, because it is easy to do so. Because and I've seen this in my own community, for people who struggle with, impulsive eating or struggle with, binges or feeling out of control around food for the first time in your life, being on these medications, feeling in control, not thinking about food all the time. Because we didn't even really get to touch much on like the food noise conversation, but you're not thinking about it all the time. You're not feeling this need to eat all the time. It can start to feel empowering to go long periods of time without eating. And that's
yeah,
very disordered. And we
yeah,
don't want to fall into that. And, when people have gone their whole life being shamed for eating too much or being shamed for their food choices, not having to make them at all can seem like such freedom. But we don't want to fall down that rabbit hole, because, like you said, the last thing you want is to have to dig yourself out of that and, replace one problem for another.
yeah. Thanks for addressing that. And I know we're short on time, but I really want to dive into this real quick.
Mhm.
The supplement industry.
Yes.
Um,
Oh,
so this is like a whole episode. I've seen in my neck of the woods, I'm sure everything you've seen. I've also seen some sports nutrition companies shouting out UCAN, touting their supplements as a GLP-1 medication replacement or just as effective or nature's GLP-1. Thoughts?
I have a lot of thoughts, and I can stay on a couple more minutes if you can, if we need to, because this is
Yeah.
different. And I just want to say, for anyone who wants more like research on this, I have a ton of stuff on my Instagram page right now where
Awesome.
I literally, like, I started a new series called Truth or Tale, where I'm like debunking these things and actually breaking down the research behind some of these supplements.
Thank you.
Um, I want to be incredibly clear. There is absolutely nothing on the market that is going to replace or mimic GLP-1 like results unless it's an actual GLP-1 medication. We are seeing, yeah, quote, nature's Ozempic, GLP-1 booster, GLP-1 activator. The GLP-1 booster is by Supergut that I just debunked. And there's some mega bariatric influencers promoting it right now, which is honestly icky, because you're preying on people who are desperate to lose weight and get GLP-1s and cannot, because of affordability, because of accessibility. And there is one particular influencer who has like over 1 million TikTok followers promoting this GLP-1 booster, saying it's like just the same as GLP-1. You don't need to be on like a medication. You can just be on this. It's a fiber supplement. It's literally resistant starch.
Oh
It
my
is
God.
nothing but fiber. So, and here's the thing, and this is the caveat. Like I said before,
Wow.
you can produce GLP-1 naturally. We know that having a high fiber, high protein diet is going to produce GLP-1. The thing is, you're not getting it at the therapeutic levels at the consistent rate that you get when you have a medication. Your body burns through the GLP-1 it produces before you reap the benefits of it. So, the claims that this study has like a clinical trial, which I broke down, their clinical trial shows one that you can lose 3 pounds, I think, in 3 months or something, which that's not comparable to GLP-1 like results. Also, a study showing weight loss in pounds versus percentage is a red flag anyways, because it's going to be different based on the person. But the other thing that they showed is a slight improvement in hemoglobin A1C, which is, important for blood sugar management. My
Fiber.
my response to that is no duh, you're having fiber. Like like yeah, we know that, but so they're taking that small claim of it can improve your A1C. We know that that's not going to give you GLP-1 like weight loss results. So the way it's being marketed is very sneaky and very sketchy. The other one I've seen is by LifeVantage, which is like a huge MLM company that now has this GLP-1 activator and this huge clinical trial, which I also broke down. It was the world's worst like study ever. So you can go read more about it. Again, it's an MLM. It's a pyramid scheme. And their GLP-1 activator is like random supplements. It's like an eggplant powder combined with like a resistant starch. It's just like has some chromium in there, which is not proven to help with like weight loss. It's just like nonsense. I literally spent a whole day Saturday like on a rampage breaking this down because I cannot believe that people within the bariatric space are promoting this. But the thing with the GLP activator, they kept saying like, we found that it boosts GLP-1 by 140%. That sounds significant when you say that, right? Like, oh my God, it boosts it by 140%. That's over 100%. That's amazing. But like I said at the beginning of this episode, semaglutide boosts it by 700%.
Yeah. It's not a
So,
replacement.
not a replacement.
Yeah.
So yes, you can activate GLP-1 naturally, does not mean you're going to get GLP-1 like weight loss results. And that's the really icky part is you have all these companies and now all these influencers jumping on the bandwagon of knowing people are desperate and vulnerable to really just wanting these medications, can't get them. You're preying on low income people as well. It's so icky in so many ways. So if you're watching this, just know, like, please don't fall for it. And you know what, if you want to, support your favorite influencer, go for it. I have codes, like we all have things that we promote and love. And if they genuinely love it, I suppose that's okay, but it's the way they're portraying it. So if you love the GLP-1 booster, say what it is. This is a fiber supplement that helps me be regular that I really love. If you need more fiber, go for it. Don't say it's going to give you GLP-1 like weight loss results. It's all about how you're portraying it. And that's the really icky part that we're seeing amongst many industries right now.
Thanks for touching on that. Yeah, I think it's like it's preying on, people's insecurities. Like you said, it's preying on the fact that maybe they can't afford medications. And I think also it reinforces that there's stigma to take medication. But like this natural supplement's fine, even though the supplements are not regulated by the FDA at all. So
Right, just because natural doesn't mean it's better. It also
yeah, the Wild West.
yeah, oh for sure. It's like, do this naturally. It's better. Like it's so, but then at the same time, they're taking the amazing benefit, like they're kind of shaming you taking a GLP-1, but they have no problem saying you're going to get GLP-1 like results.
Exactly.
It makes no sense.
Exactly.
It's actually wild to me.
Yeah, for the sports nutrition company I mentioned too, it's a flavored cornstarch like that you take when you want to do a long run, like as a carbohydrate, to take on a long run. And I'm like, how is cornstarch going to replace a medication? Like it's just the math is not mathing.
Unfortunately, the general public, the general population, and this is not a dig at anyone who doesn't have a background in like, science or medicine or, whatnot. Most people don't know how to spot pseudoscience. If we didn't go to school to be dietitians, we wouldn't know how to spot it. It's why it's so easy to look at marketing claims and go, oh my God, that's amazing. Oh my God, there's a clinical trial. Oh my goodness, it boosts it by 140%. Wow. Like that's so easy to fall for when it looks legitimate. But if you don't know how to actually look at the trial and break down like what was done, incorrectly, like with the clinical trial, like for the LifeVantage one, LifeVantage like paid for it, like, and they never mentioned their bias in this article. If you
Oh,
have a
wow.
bias or a hand in the product you're saying works, you have to at least mention or acknowledge that in the paper. They did not do that. It wasn't a
Yeah.
double-blind controlled. There was no placebo group. We know that when you don't have a placebo group, like the placebo accounts for anywhere from 2 to 3% of weight loss, anyways. So it was actually, like, again, I have
Wow.
all this on my Instagram page. I should put it into like a blog post so it's a little easier to read. I was big mad this last week seeing so many people I love and trust within my bariatric community who have very large platforms perpetuating such nonsense. And it makes me very mad because while I don't think people necessarily have bad intentions, when you don't have the credentials to be speaking to certain things, you just shouldn't be. And it's really misleading and unfortunate. There are going to be lots. And the GLP, want to hear the real kicker? The GLP-1 activator by this MLM company is $200 per month.
Oh my God, it's like the same.
No, literally, you could get a compounded semaglutide for the same,
Wow.
right? Like,
Wow.
it's like, are you kidding? You're going to charge people $200 for your eggplant powder?
It's
What?
magic eggplant powder, okay?
Like,
Yeah,
okay. So
wild.
it's just important to me to like try and protect people from falling for this because again,
Yeah,
you're preying on the very vulnerable people who are very desperate to lose weight and get this under control, who are at such a disadvantage.
yeah. Well, on that note, thank
On
you
that,
for
on
diving.
that happy note,
Yeah, thank you for diving into that. And like you are the expert and you do know how to read research and you do take the time out of your very busy business to debunk some of these things on your different pages. So I'll make sure to
I was
link
literally, I was
people
literally,
below.
it was, I think it was last Friday into Saturday. I don't remember the day because my days don't exist anymore. I was literally like feeding my baby to sleep in his rocking chair in his room at like 2 a.m. reading some of the things like I put the post together with all the research when I was in the right
Oh,
state
wait.
of mind.
Yeah,
But
yeah,
I
yeah.
was reading the research article while I'm sitting there on my phone feeding him. I'm like, is this for real? Like,
Yeah, I've
oh,
been there. I've
we
been
work
there.
it in. We work it in.
Yeah, I'm just on PubMed while, breastfeeding. Yeah, I really appreciate that. Where can people go find you so they can check out the posts and
Um,
everything you put together?
So my Instagram is at thesleevedietitian.com. And then if you also want to check out my website, I can send you the links too if you'd like for show notes or whatnot. But www.thesleevedietitian.com, I've actually come out with some recent blog posts on like semaglutide and Manjaro type like diet plans and how to set up your meals after
Awesome.
you're on these. So I have a lot of resources on my website as well. So my website's definitely the place to go.
I love that. Yeah, I'll put that in the show notes if you want to send that to me. But Jamie, thank you so much. I know this is like a big topic and I appreciate you sharing your professional and also your personal experience on it.
Of course, thank you for inviting me back. I clearly love talking about this and could just keep going. So thank you.
Of course, of course. Until next time.